Dr. Jaffe, as part of the preparation for having the LRA test done, would you recommend that hair dye, so having your hair colored, be avoided for a certain period of time before the blood draw? And if so, how long, and can you explain a little bit about why that is?
With regard to the question of what would we call this, aesthetics and hair color. So we're not just talking about haircuts, which are quite okay. But if you're going to have your hair chemically treated, say colored in a salon, I can tell you from what I learned from Sue Radcliffe, who is both a nutritional health coach extraordinaire and a lover of horses and donkeys, personally, she is, and a friend. And she used to work in a salon, and she became chemically sensitive to the volatile chemicals, the solvent residues, the persisting pollutants. In order to change the color of your hair, it takes pretty strong chemistry, as it turns out. And what I mean by strong chemistry is chemistry you would better avoid just prior to testing the tolerance of your immune system to such similar chemicals. So there are hundreds of chemicals. Just walk into any beauty salon that features highlights and toning and coloring and so forth. I can tell you, I once went to one of those salons and I personally would not go back. On the other hand, I hear that there are people who like the smell of those salons. It makes them a little bit tipsy. So the bottom line question is, you do need to avoid hair coloring in the immediate time before the test. So at least the 12 hours of water only. And as I'm answering the question, I'm trying to think through the question of, would we say 2 days or not? Because it's when you're in the salon that you're exposed to the chemical. It's when you're in the salon that you breathe the chemical. Now, if you're sensitive and you're chemically exposed through the skin or through your breath, you will briefly activate your lymphocytes. But I suspect not more than 12 hours. And so I would officially say you shouldn't have your hair colored in the 12 hours of water only. So that really doesn't change what our practitioners would do. But I'm glad to add that to the instructions, because if for any reason you were going to have your hair colored in the 12 hours before the test, do it after. And if, Jayshree, if someone asks you as you're training them, it's better to not introduce foreign chemicals for a couple of days prior to the test. Right. The ones we know about, of course, are the antihistamines and aspirin for 2 days, steroids for 4 days, but transient exposure to hair salon chemicals and volatiles. I'd be very surprised. We haven't done a formal study, and I don't know if we're going to do one, but I'd be very surprised if the effect lasted more than 12 hours.